Obesity is reaching epidemic proportions in the United States of America. Medical costs of obesity are as high as $147 billion in the U.S. alone. More than one-third of U.S. adults are obese. 26.1% of adult Floridians are considered overweight. Almost 65% of adults in Miami are overweight. And the children in our community are on the same path. Eating healthy foods and exercising can help, but what happens when there are no healthy foods available and no safe places to exercise? People can't make healthy choices when there are no healthy choices to make. The environments where we live, play, work, and learn have an impact on our health. That's why the Consortium for a Healthier Miami-Dade, along with partner agencies, created Make Healthy Happen Miami. We can now imagine a healthier Miami.
The CPBW program, which is Communities Putting Prevention to Work, is basically a national initiative. The intent of the federal government was to basically get the different states to the point that they had some capacity to improve not only policies but environmental situations and system situation where people could have a healthier lifestyle. They're going to do this through these grants that they're giving out to the states. By implementing strategies that are evidence-based and that will change policy and will change systems and will change the environment for folks to be able to lead a healthier lifestyle.
Did you know that 65% of us in Miami-Dade County are overweight or obese? That's one reason the Consortium for a Healthier Miami-Dade was created, to make living healthy easier for you and your family by encouraging wellness programs in the workplace and better food options in our schools and communities so that you can manage your busy schedule and stay healthy too. Let's make it easy to be healthy in South Florida. This message brought to you by the Consortium for a Healthier Miami-Dade, sponsored by the Miami-Dade County Health Department.
In terms of obesity, we do have issues. If you look at our rates compared to the state of Florida, we're not too far above of the rate of Florida in terms of what we call body mass index. But we do have an issue in terms of the tendency, where the tendency is going. It's going up and it's not going down. 65% of our adults are considered obese or overweight. And we have some concerning statistics in the area of our children. We see a tendency towards being overweight at such a young age. We need collaboratives to be able to get the work done. The work is daunting, it's massive, and it involves a lot of behavioral change. And you need different type of input, different type of conversations going on in the community and decision making to be able to make things work.
Imagine how healthy Miami will be when everyone has access to safe places to walk, bike, and play. To see how you can make healthy happen, go to makehealthyhappenmiami.com.
As a Haitian American who helped, guide the message in the Haitian community about making Faire Santé Marché, it was very difficult because, culturally, Haitian Americans, there's a lot of dishes and a lot of stuff that we eat differently and we cook differently. So this was a very eye-opening experience, and this initiative actually helped us be aware, a little bit more aware of how we could do some stuff. For example, griot, which is a very, very popular Haitian dish, which is fried pork. We had to go out in the community, in the churches, and in different schools, community centers, and talk to folks about how they could cook griot with the same flavor, the same taste, instead of frying it, baking it, where you could get the same components of it. And another favorite dish is légumes, which is a combination of vegetables and meats and stuff. And we actually went out there and encouraged folks, if they go to the farmer's market and get fresh vegetables to make the legume, that will be beneficial to the entire family. So those were some of the strategies that we used in the Haitian community to get out the word on Faire Santé Marché, eat healthy and live healthy where you work, and for the entire community.
Our Parks and Recreation Department, which is the department that I work for, is very involved in the chronic disease prevention here in the city. What we're trying to do is work on a community action plan that we developed in 2009 that included working on chronic disease prevention, nutrition improvements in every aspect of the community. And our farmers market was one of our goals and objectives that we wanted to include in that community action plan, and that's how we've been able to incorporate it. The farmers market is in a location that it's right outside of our municipal building, so it gives the employees the motivation to get out, walk, take a break, have some peace and tranquility, also get something, a bite to eat, and get some products that they can go home with and feed their families with. So really that's one of the main goals, because it's also part of our worksite wellness, but we also want to give the residents the opportunity to come out, walk, and really, have access to something different in our main area. We have a great plaza, and it gives them a chance to get out and enjoy it. And our message is healthy places, healthy people, that we started with, so we want to maintain that and just give that option to people in different ways.
Markets are really nice because you've got local people selling frequently locally made products, and even if they aren't locally made, at least we're giving people an opportunity to have some products that might be available in other markets.
I usually go to farmers market every Saturday or Sunday.
I can bring my son. He enjoys shopping, and I can teach him how to select food from the market.
Kids should know where their food comes from, and here you have the opportunity to meet the farmers, to meet the people who actually make all these different products, and we get the enjoyment of interacting with the community.
My husband is the one who encouraged me, and he introduced me to farmers market. After that, I continue going it.
There's a wide variety of people from North Miami, a lot of different cultures, so it's usually very steady, this market. It's a really nice market, and I live nearby too, so I like supporting my neighborhood.
I would like to tell other families to take advantage of the freshness of the food that is offered at the farmers market, and also to encourage local farmers in really growing and making it available to the community what is grown in the area.
I guess because the produce is grown locally, it takes less time for the produce to get here, so it's always fresh and it tastes so good. And if you compare it to a supermarket, it takes some time for the fruits and vegetables to go to the supermarket, and as a result it's more fertilized, it has more pesticides. So I like local grown produce.
We do this because we love food, and we believe in what we do, and we believe in what we sell. And so to get such positive feedback, and then get the repeat customers, and then eventually word will get out that we're here, and so we're confident this is going to be a successful market for us.
Go Fresh Market, yay!
Imagine how healthy Miami will be when everyone has access to safe places to walk, bike, and play. To see how you can make healthy happen, go to makehealthyhappenmiami.com.
Our role with CPPW was really to increase the number of kids walking and biking back and forth to school. This was our effort in trying to address the issues of obesity amongst the community. We're very focused on teaching kids about safety and about creating a more injury prevention environment. So we teach kids about pedestrian safety and bike safety. We teach them to be very aware of their surroundings with regard to this. We're also very much about health promotion, so we want them to understand that to take advantage of a routine activity, which is walking back and forth to school. It's something you do every single day. It's easy enough to do, and it can help you physically with your mental health, with your physical health. Overall, Miami-Dade County tends to be a place that is becoming more bike and walk friendly. But by being able to approach kids and explain to them how to be safer as they're seeing all this activity of biking and walking in their community, I think it's incredibly useful for the future, because now kids can actually take advantage of this form of active transportation and do it safely. Our call to action through Make Healthy Happen Miami would be to walk and bike more, and to be aware of your community, to take care of your community as well as to take care of yourself. Be healthy and be safe.
We believe, like many communities around the country, that every great community has a great park system. And what our goal is to build that great park system. And we do that through a system of great parks, great public spaces, great natural and cultural areas, and we link that all together with great greenways, our bikeways, and our streets. The ability to work with the health department on things like community gardens and working on the worksite wellness programs and all the elements that we brought together in this program has been very important to the Parks Department, because we simply would not have been able to get this off the ground without it. Our goal in marketing this has been getting it into every household. We do a quarterly newsletter that goes out to 35,000 households every quarter through the Miami Herald, and in it it's about a 12-page guide that gives all the scheduled events and activities that are happening in your parks. We've got a lot to offer, and we market it that way.
We know the benefit of exercise, how the exercise could alleviate those pains that come with aging. So that's why we work every day.
We walk about 40 minutes, we exercise for an hour, and then we play games afterwards.
The seniors have been responding very well. At first, it took them probably about a week to get into it. That first week, we had some soreness, but after that, they started to love it. We started to get into, we did dances with them, we did different things so they could get more active and more involved in what we're doing here. We had one senior who is still here who was able to go around, and she did every single machine with no problem.
From a Parks and Recreation perspective, the impacts are creating a healthier community. We want to encourage more people to use their active transportation as far as bicycling and walking and getting out there and creating a healthier community as a whole. Overall, I'm very proud of the efforts that have been made to date, and we know there's a lot of work to be done going forward in the future. The city has implemented a lot of changes to encourage the use of bicycles by installing bicycle racks throughout the city and utilizing sharrows along 125th Street and creating an east-west corridor for the use of bicycles that creates a safe haven for bicyclists.
I wish every municipality in Miami-Dade County and South Florida really should, I think they all should have dedicated bike lanes, or not like here in 125th. Regular lanes that are sort of designated for bicyclists as well.
Imagine how much healthier Miami will be when businesses, large and small, make wellness a priority by encouraging physical activity and healthy eating. Worksite wellness programs can reduce sick days taken, control healthcare costs, and lower staff turnover. Make healthy happen, Miami. Ask your employer about turning your coffee break into a fitness break. Visit MakeHealthyHappenMiami.com for more information.
The goal of the CPPW Worksite Wellness Initiative was to increase the number of worksite wellness programs that offer nutrition-related policies and also increase physical activity in the workplace.
An ideal healthy worksite incorporates more than just physical activity and nutrition, but it's wide-ranging. It's looking at the overall health, the mental health, the spiritual health, and then the physical health as well of the employee.
There are several benefits from the employer's perspective. For every dollar that's spent on an employee wellness program, $3.27 can be saved in medical care costs. In terms of absenteeism, that number is $2.73. So up to $6 can be saved for every dollar that's put into a wellness program. And also, from the employee's perspective, when they know that their employer cares about them and is offering these types of programs, they're more committed, more dedicated to the work that they're doing. So you will see improved employee morale. And then not only that, but the employee health status will actually improve when they have opportunities to walk or to get a healthier meal at lunchtime. Then it really impacts their overall lifestyle.
Imagine how much healthier Miami will be when more children have great beginnings from breastfeeding. Breastfeeding reduces obesity in children. Breastfed children also suffer fewer fevers, ear infections, and allergies. This is why doctors recommend it exclusively for the first 6 months of life. Make healthy happen, Miami. Ask your doctor or hospital how they will support your decision to breastfeed. Visit MakeHealthyHappenMiami.com for more information.
The American Academy of Pediatrics recommends that a woman breastfeed exclusively for the first 6 months and then continue thereon after with complementary foods for as long as they both should choose to breastfeed. That's important because that's the best thing for mothers and babies is exclusive breastfeeding to 6 months. But what we actually have happening is at 3 months, the exclusivity rate drops dramatically. Close to 32% only are breastfeeding exclusively. So we go from 80 to about 30%, which is not necessarily a good thing. And when you look at breastfeeding all the way to 6 months exclusively, we're down to about 13%, and that's significant as well. So this is really what's made this project so very important for the whole state of Florida and the country as well. Breastfeeding and obesity has been linked. What they found is that with obesity and breastfeeding is if a woman actually breastfeeds exclusively for 1 month, she reduces the baby's chance of getting obese by 4%. And every single month thereafter, she continues to reduce that child's chance of becoming obese later. So any breastfeeding is better than none. For sure. But what's happening is that the CDC has recognized breastfeeding as a very important initiative to help to reduce those obesity rates. So what we currently have is about 1 in every 5 children in the United States is either overweight or obese. So this is significant. And so the CDC is recommending that hospitals become baby-friendly and communities make breastfeeding-friendly policies, meaning that workplaces start to address women returning to work and still breastfeeding.
Having the policy at work, it definitely encouraged me to keep breastfeeding. That was sad because when I came back to work that I thought that we were not going to be able to keep on breastfeeding, but having the policy, it encouraged me to keep on breastfeeding.
By having a lactation support policy in place, it offers the employees support to continue breastfeeding and nurturing their baby by providing the best source of nutrition for their infants. It also helps to support the employee and shows that it's a breastfeeding-friendly environment and to continue to reach their breastfeeding goals with increased immunities for the child and for the mother, reduced absenteeism, lower health care costs. Overall, it's a benefit and a win-win for both parties.
Research indicates that there are benefits for the employer, for the employee, and for the community when breastfeeding is supported. Of course, for the baby, breast milk is the best nutrition and should be the only form of nutrition as per the American Academy of Pediatrics. In addition to that, for the employee who is breastfeeding, we know that many moms stop breastfeeding when they return to work. So having lactation policies to support breastfeeding in the workplace ensures that the mother has the incentive and the support that she needs in order to continue to provide breast milk for her baby when she returns to work.
I would say developing a room at Miami Beach Community Health Center for breastfeeding dedicated for employees or moms that are just breastfeeding coming back to work has been an amazing experience. I have learned a lot and what it requires to actually have a place designated, and I was glad that to be the actual first community health center to have a room in our county.
I think the most important thing right now is to work with our mothers prenatally. We need to teach them about asking the hospitals for these services, asking, I want my baby put skin to skin the first hour after birth. And I'd say, more prenatal education, helping women know how to get past those barriers, like going back to work or starting solids or feeling like they don't have enough milk. That's when we begin to educate women in Miami-Dade County, they're going to be able to get past those hurdles and their fears that they might not have enough or they can't go back to work or school. So that's what our call to action is really to make a community change now, really work with all community-based organizations.
Imagine how much healthier Miami will be when high school students take advantage of healthy vending machines at school. Fresh, healthy options are available in the cafeteria and on the go, making it easy and affordable to make better food choices. Make healthy happen, Miami. Support healthy vending machines in schools. Parents, ask about the nutrition and wellness policy at your child's school. Visit MakeHealthyHappenMiami.com for more information.
Miami-Dade County Public Schools Department of Food and Nutrition was very excited to participate in the Communities Putting Prevention to Work grant. We received monies to purchase vending machines. They are very different than a typical vending machine in that they dispensed freshly made school meals to students, and also we participated in a farm-to-school aspect of the grant where we were provided resources to spend time to make connections with our local farmers and to create distribution opportunities so that locally grown fresh produce could find its way right from the grower to our school cafeterias on the menu for our students. You know, implementing the healthy vending machines was amazing. We knew we were onto something, but we really didn't realize what a great innovative way to deliver healthy meals we had created by purchasing the healthy vending machines and then serving fresh salads, turkey sandwiches on whole wheat bread, yogurt parfaits. And what we discovered is that high school students, we know they're smart, we know they're super savvy with technology, and we also know that they want to be healthy. They want to have a healthy choice. And by offering these choices in a machine where they put in their number, nobody had to bother them or tell them to stand over here or stand over there. They could get it on their own. They loved it.
We made healthy happen with fit and fresh lunch choices in Miami-Dade County Public Schools
and in vending machines and school cafeterias.
You know, our marketing campaign, Make Healthy Happen, people believe in that. They need the opportunity, they need the access. When we started with our vending machines, we also had the good fortune of having some of our local celebrity chefs who are our partners at the Department of Food and Nutrition. They love the machines. So our call to action is to continue to promote innovative, fast, easy ways for students to get healthy meals at school, and also we are expanding into breakfast. So we're very excited because we're actually taking our farm to school connections as well as our healthy meal vending machines and using them to promote the school breakfast program.
Imagine how much healthier Miami will be when physical activity is part of every child's day because parents and child care providers make it a priority. 60 minutes of daily physical activity is recommended for all children. Rain or shine, kids can be as active indoors as they are outdoors. Make healthy happen, Miami. Ask your child care provider how they plan to keep your child moving. Visit MakeHealthyHappenMiami.com for more information.
The statistics in Miami-Dade County for childhood overweight are very alarming. In fact, research shows that about 1/3 of children in this county are either overweight or obese, and rates are even higher among ethnic minorities. For example, a research study we recently conducted here at the university showed that 42% of Hispanic Cubans are either overweight or obese, and that's for children ages 2 to 5. The CPPW Child Care Project was a multifaceted intervention targeted around 4 major policies. One was a beverage policy, a snack policy, a physical activity policy, and a screen time policy. The goal was to reduce obesity in this age group of children birth through age 5. The really unique thing about it is we didn't just implement the policies, but we tried to give the facilities as much support as we could. So we did a lot of training with the teachers, and we did a lot of technical assistance on site in the child care center to really get centers up to par and where they should be in addressing this epidemic.
Videos and computers can be fun, but if we don't go outside and play, kids can become overweight.
Experts recommend 60 minutes of physical activity each day and limited screen time. When we create healthier places to live, work, and play, what we're really creating are healthier lives. Parents, get involved and ask about the indoor and outdoor physical activity program at your child's school or daycare. For more information on getting your child moving, go to MakeHealthyHappenMiami.com.
I find it was really great. It gives us an opportunity as providers to really connect with the parents with issues that are currently, affecting us as a nation. Obesity is something that is affecting us in America. So with what the CPPW has done is provided us with musical instruments as well as CDs, outside toys balls and all those equipments that we can take outside and have the children exercise with. it's all in their presentation. You know, what we talk about is like healthy eating, which we always need to teach children from young. Being that it's a home daycare, it's a very more personal environment, and I do have opportunities to give parents daily feedback with the children. So in addition to just sending home the newsletter, we talk about it once they come to pick up their child, and I just share like the importance of what good health and nutrition does for us as a community. When it comes to the physical activity, I usually work with the kids. Whatever I need them to do, I do it so that they can replicate what I do. It's considered active learning. We all know we can say whatever we want, do this, don't do that, they don't do it. The kids will emulate whatever you do. So in order to get them to be physical active, which I think naturally at their age, they be bouncing off the wall, I just have to do, what I need them to do, and they would follow along with whatever I do, So I'm just kind of like the leader of the pack. And it also keeps me physically fit also. Both the parents and children have reacted in a very positive way because, like I said, they help me along with whatever lesson plan that I present to the children and I share with the parents. They always support me. So corn is your favorite fruit or vegetable?
Vegetable.
Right, because corn is a vegetable. And what is your favorite fruit?
Apple.
Apple. And what kind of apple you like? The red one, the green ones, the yellow one?
The yellow one.
So you like the yellow fruit. Yellow apple is your favorite fruit. And corn is your favorite vegetable. So both your fruit and your vegetable are the color yellow.
Our role was to make sure that we work with 1,500 licensed child care centers and home in Miami-Dade County to ensure that they were able to receive physical activity, 30 minutes a day in the morning, 30 minutes in the afternoon for their children 0 to 5, as well as increase nutritional meals that were provided to their children. We also worked with a registered dietitian to ensure that their menus were revenue neutral and that children were afforded nutritious meals at least once a day, and as well as nutritious snacks. And the other role we had for them was to reduce screen time so that children were learning and spending more time learning than watching television. The call to action for every single one of us who are early childhood educators. It is important that our children learn. It is important that our children grow up healthy. They are our future. They are the ones who will someday be the President of the United States. They'll be our senators, they'll be our legislators, they'll be our teachers, they'll be our principals, our pastors. The future for them is endless, but it starts with us. We need to continue to be serious about making sure that our children, there are 100,000 of them that go to licensed child care centers every day in this county. And it is our job to make sure that they are wise, healthy, and strong. We have an opportunity to continue that momentum. We shall not let it die. Our children will be the future. Our children will be strong, our children will be educated, and our children will succeed in Miami-Dade County.
Putting prevention to work requires more than one organization in a community to work together. What was wonderful about the CPPW project was that we had a coalition of organizations that the health department put together with other community agencies like ours to all work on different pieces of the goals and objectives of the community's Putting Prevention to Work project. And if it hadn't been for the health department creating a coalition, we wouldn't have gotten that much done.
Well, I wish the federal government will give us more money to continue our efforts. If not, I really hope that through community advancements we could see different type of opportunities come along, because sometimes it does take funding and it does take money, but we, the health department, will not let all our wonderful interventions die. We will continue to work and make sure that we try to spearhead all of the initiatives that we had going in some way, shape, or form with the help of our community. Again, as we started this conversation, it was about collaboration, and we hope this collaboration will continue because we do have momentum, and that momentum hopefully will be able to move it forward.